It's that time of year again. The weather gets a bit colder, and Halloween candy gorging gives way to Thanksgiving turkey binging. I'm talking, of course, about flu season. Getting the flu is no fun. Fevers, chills, sore throat, runny nose, muscle aches, headaches, fatigue, even possible diarrhea and vomiting. The flu is not just a nuisance. The scary thing is that the flu can be a lot more serious than just a few days in bed feeling lousy. While most people are back in fighting shape within a few days to a week, some people can develop serious complications, including pneumonia, bronchitis, sinus or ear infections, or worsening of other health problems like heart failure or asthma. The flu can even be fatal. Adults over 65, people with chronic disease, and kids are the most at risk. Last year alone, there were 149 kids who died from the flu. Luckily, the flu vaccine is a safe and effective way to protect yourself and loved ones from the flu. It used to be that flu shots were only available in a doctor's office, but nowadays there are no excuses to skip that poke. It's offered in most pharmacies and clinics in the area. If you want to know where to get a flu shot, go to flushot.healthmap.org. So who should be getting a flu vaccine? It's pretty simple.
The flu vaccination used to be rather complicated. Now it's extremely simple. That is, if you're 6 months of age or older, get your annual flu vaccine.
Flu season is unpredictable, so it's important to get your vaccine as soon as possible.
Sometimes we think we're going to have a major flu season, then it ends up being kind of going, with a whimper. And we know just from previous experience that the flu season, it can peak anytime between October and April, although it's more common that we might see that in January or February.
In Palo Alto, residents lined up to get the flu shot at area pharmacies. At CVS on University Ave, they got a jump on flu season early.
It started off, usually it comes around September, but this time we got it early towards the end of August. Anytime the CDC releases the vaccine, it usually gets drop shipped to all the pharmacies. So we started, this year we started in August. Palo Alto is definitely prepared for the flu. People over here are very health conscious, they're very educated.
Sarah Villarreal and Nicole Miller both work in downtown Palo Alto, so they stopped in on their lunch break to get a shot. Nicole knows firsthand how awful the flu is. She had it just last year.
It sucked. They're just constant bed and vomiting. I don't really want to experience that ever again.
For faculty and staff at Stanford University, getting a flu shot is as easy as making their way to a dining hall.
Wipe you off with some alcohol, you give your arm a good grab, and then after you're going to tell her on the scale 0 to 10.
A group of medical students called the Flu Crew partners with undergrad volunteers to publicize the events and give out the vaccines.
And so we've been doing the dining halls for, I think, about 4 years now. I'm a first year, so this is my first year doing Flu Crew. But from what I've heard, Flu Crew history is 4 years on campus since basically H1N1 in 2009.
In addition to vaccinating Stanford, Flu Crew also gives free flu shots in the surrounding community.
So last weekend we were at a church in San Jose. We've done some homeless shelters in San Jose as well. We have a couple libraries we're hoping to go to. Farms are the other kind of big piece of our community events. We've been out to vaccinate at farms in Morgan Hill. So it's a good variety. It's a great way for the med students, as you know, to get out and see patients in the first year. And very hands-on, so we've really been enjoying it.
For the med students, it's a chance to interact with patients for the first time.
It's kind of scary, actually. Yeah, it's the first time, performing a real medical procedure, but after a few, it starts to feel kind of routine, and you can relax and talk to the patients and kind of really, get a sense of what it feels like to be a doctor, which is exciting.
As for me, I rolled up my sleeve and got a flu shot from one of the med students. Ouch! Just kidding, it didn't even hurt. The best part is that by getting a vaccine, I'm not only protecting myself, I'm protecting the people around me and the whole community because I won't be spreading germs. Doctors and healthcare professionals have one unified message.
Come and get it. It's not worth suffering through the sniffles. If you have something that can protect you for something as horrible as flu, get it, because it's not just you. I mean, once you get the flu, you are essentially spreading it out.
This is Hayley Goldbach reporting for the Peninsula Press, a product of the Stanford Graduate Program in Journalism.